You. You're the person the world needs. Life is changing, and the future is uncertain. You may not know how or why yet, but you know you're here to make a difference. You're not waiting for the universe to give you the answers. You're finding them for yourself. Challenging echoes with evidence. Few people have great ideas. Even fewer make them happen. It takes a dreamer, an explorer, a researcher, a leader, a thinker. It takes someone like you.
Good evening and welcome to the UNSW Medicine Information Evening. My name's Nick. I'm the Senior Recruitment Product Manager for our faculties of Science and Medicine and Health here at the University of New South Wales. It's a bit of a cumbersome title, but effectively it means that my role is all about ensuring you've got all the information to make the right decision for you. And today is very much one of those first steps to finding out everything that there is to know about medicine and health here at the University of New South Wales. As we begin, I'd like to acknowledge the Bedegal people who are the traditional custodians of this land. And I'd like to extend my respects to the elders, both past and present, as well as any other Aboriginal and Torres Strait Islanders who are joining us here today. We've got a really exciting, jam-packed really, and we're going to dive into it very quickly, jam-packed schedule for you today. We've got Dr. Sean Kennedy joining us, who's our Program Director for the Bachelor of Medical Studies, Doctor of Medicine program. And we're also very fortunate to be joined by two of our current students. They're fourth years from our Medicine Student Society, who are going to run us through the ins and outs of the admission side of things when it comes to medicine and health, and also the student experience, what you can expect as a student here at UNSW. We've got Q&A live throughout the entire evening, and I can see already that questions have been coming through since 4:30 today, so excellent that you were jumping on very early and very eager. That's brilliant. Ask as many questions as you possibly can, because that's really what we're here for tonight. So make sure that you walk away with all the information to make a really informed decision about whether UNSW Medicine is right for you, and all the other options that are out there as well. We'll be touching on things like careers, other degrees as well that you might consider, where you could make a really impactful difference when it comes to people's lives and health in general. So as we dive into things, I'm actually going to start off by giving you a little bit of an overview of UNSW, who we are, where we've come from, and really where we're going. So as a university, we were founded in 1949. And that's really important because we were initially a technical institute. We were there to fill in the gaps in terms of a shortage of scientists and engineers in New South Wales, but Australia more broadly as well. And as a university, we've just grown since then. So 60,000 students, we've got 300 plus degrees across 6 unique faculties, everything ranging from things like medicine and health to arts, design, architecture, science, still engineering, obviously very strong in, but a huge range of areas, including business as well. So lots of different options that you can do. We see students doing plenty of double degree combinations. And behind all of this is our work integrated learning team. It's probably one of those words at the moment that doesn't mean very much to you as prospective students, but as a current student, it's going to make a lifetime of difference. So work integrated learning is doing subjects, and in particular doing internships, work placements that count back towards your degree as course credit. And across all of our programs, across all of our degrees, we make sure that there are work integrated learning opportunities for students. And indeed today we're going to hear a lot about the kind of clinical placements that you can get involved in as part of the medical program. We're very fortunate to have a medical program and a medical school which is in the top 50 in the world, and I think it really speaks to the academics, but also the kinds of students you're going to be learning with. You're going to have a cohort of students who are going to challenge you, they're going to push you, but they're also going to be your network when you graduate and across indeed your entire career. There'll be that support, there'll be your colleagues across every area and every specialty of medicine. And indeed, more broadly, the other students you'll be mixing with across all of our faculties, they'll be your connections across every industry. So it's very much about support and indeed making sure that you've got the opportunity to grow and excel. The other thing I'll touch on is that the medicine program is a really in-demand degree. So we're very fortunate that it's, for the last 4 years, been the most in-demand degree with UAC. Now, it means it's a very competitive program. I can see we've already got questions about what is the ATAR and the entry requirements that I need to get in. Rest assured, we're definitely going to cover all of that today. But just keep in mind that there's a huge range of programs out there if you want to make an impact when it comes to medicine and health. Some of the clinical programs that we offer at UNSW range from things like exercise physiology, doing our psychology honours program, and going down the pathway to become a practicing clinician on the psychological side of things, vision science and clinical optometry, but also lots of non-clinical programs, things like our engineering programs combined with things like the Master of Biomedical Engineering, medical science, vision science, and in today's current climate where we're dealing with major health issues like a global pandemic, degrees like international public health are more relevant than ever. And it's about really making impactful changes that impact everybody's lives, but from a policy perspective and looking at the broader health implications there too. So there's plenty of different pathways, plenty of different careers to get you excited about pursuing a career into medicine and health. Today, we're going to focus very much on the medical programs, the Bachelor of Medical Studies, Doctor of Medicine. But again, keep in mind that there's a huge range of career opportunities out there. And this is really the first step in finding out what's going to be right for you, and indeed all those other opportunities that are going to be out there thereafter. So without any further ado, I'm going to introduce Dr. Sean Kennedy to the stage. He is our program director for the Bachelor of Medical Studies, Doctor of Medicine, and he's going to give us a run through as to how the structure of the program works and really the nuances and the intricacies of what you can expect as a current student. Dr. Kennedy.
Thanks, Nick. And I've got to say it's a pleasure to be here. I'd like to be able to see you all, but it's great fun for me to be able to be here and have a chat with you about two things that I feel really passionate about and really love, actually. One is being a doctor and working in the field of medicine, but the other is the medical degree and the medical course here at the University of New South Wales, which I think is exceptional, and I'm very proud to be part of it. So I'm going to give you a bit of an overview of the course, what it would mean if you got into study with us and studied with us with medicine. It is a 6-year course here at UNSW, so it's an undergraduate course that runs over 6 years. And the way we break it up is that there are 3 phases. Each phase has 2 years in it. Phase 1, Phase 2 and Phase 3. So I'll just give you a bit of an overview of what it's like if you were to be studying with us. At the end of those 6 years, you graduate with 2 degrees, a Bachelor of Medical Studies and a Doctor of Medicine, or an MD. So you're fully qualified. Then at the end of that 6 years, you can go on and start your internship and then continue this lifelong journey, this great journey, which is what we call medicine and working as a doctor in medicine. Our Phase 1, the years 1 and 2, are your introductory years, but you're not really thrown into it straight away, but you very quickly get into medicine and studying medicine and understanding what being a doctor will be like when you're 6 years' time once you graduate. What looking after people's health and well-being is all about. And we do that in those first 2 years with you working in teams, working with your colleagues. So when you're in first year, you'll work with other students from first year as well as students who are in second year. And that's a great model because they can give you some mentorship, some guidance, and sort of bring you up to speed quicker than if you were just doing it all on your own. You work most of the time in groups, and we call them scenario groups. So it's a scenario-based learning. And the scenarios that you're given and that you study from and you learn from are basically real-life scenarios. They're about people's health and people's illnesses, and you learn from that, and using those you get to incorporate and learn the basic sciences, things about the biology and the microbiology and the pathology, all the ologies that go into learning to be a doctor. Once you've done that first phase, Phase 1, we move into third year, which is Phase 2. Now, we're starting then to bring you more into the hospitals. During Phase 1, you do spend some time in clinical settings, including hospitals. So there'll be times where you come up to the different hospitals, and I'll talk about them later, and you'll have some teaching by doctors on the wards with real patients. But in Phase 2, Year 3, you're very much embedded almost into the hospital. So it's an integrated course in phase 2, where 3 days a week you're doing clinical training, clinical learning, clinical education about talking to patients, examining patients, helping patients, working in teams in hospitals. And then also 2 days a week where it's more on-campus learning. And in the last 12 months in particular, we've adapted a lot of that on-campus learning to be doing a lot of it like this, sort of online learning. So it's quite a flexible program now because of that. Now, I did say that each phase is 2 years. So phase 2 is year 3 and year 4. I'll talk more about year 4 in a little moment because it's a bit different. It's a year of research. But once you finish phase 2, you move to phase 3, which is really the nitty-gritty, the apprenticeship of being a doctor, where most of the time you're in hospitals or in clinical settings. That's in through year 5 and year 6. And you get to move around and you get to taste and experience all the different specialties that are out there on the platter for you as a doctor in training and a medical student. And that's one of those great things that I do love about medicine, and that I think makes it a fantastic career and a fantastic career opportunity for you, because studying to be a doctor doesn't just mean you're going to graduate and look exactly like your colleague. There are so many ways you can go once you graduate, so many routes for specialisation, and I'll talk a bit more about a few of those. But let's go back to that year 4, the research year. We've called this your independent learning project year, or an ILP. And all students during that year will spend most of their time doing research. Now, the majority of the students, since we've made some changes in the last 12 months, and this will be moving forward into next year and in the future if you're studying with us, the study that you do during that year will allow you to qualify with honours. So you'll have an honorarium within, honours in brackets after your name once you graduate, because of the research project. And this is a fantastic, exciting piece of work to do within your medical degree, because you get to research, again, such as broad opportunity to choose different areas of research. You could be doing research in hospitals or in general practice, where you're directly involved with patients, perhaps in a clinical trial, where the patients are getting given some treatment and you're seeing if this treatment is effective in treating the problem that they have. You could be doing research where you're in a laboratory, where you're looking down a microscope, where you're pipetting solutions. You see, around the time particularly on Sunday night news, when they have a medical story or a research story, you always see the politicians or the journalists with a white coat on and a pipette over in all this laboratory equipment in the back. You actually get to learn to do that and be able to use these things and understand what medical research is for and how it makes a difference to us as a population. And you can do research where you're using big data, so computer derived algorithms, collecting data that we have from population health, and examining and understanding health problems in the here and now. So many opportunities for this research project, and we'll help you find the project when you come getting closer to that 4th year. As I said, at the end of your degree, once you graduate, that's really only just the beginning of the journey in some ways. So this slide takes you through that. There's a continuum of learning, what it's like to be a medical graduate. You do your undergraduate studies or your medical degree, it takes 6 years. For most of us, sometimes it takes a little bit longer, but for most of the students, we'll get through in 6 years. Then you do 1 or 2 years in the hospitals, your internship and your residency. And then at that stage, you get more opportunity to make decisions. You don't have to make a decision in that 3rd year. You may put it off until you get more experience, but then you can go off into one of the many vocational training within medicine. There's a huge variety of things you can do. The traditional doctor that we think about, general practitioner, still, Probably not the majority, but still a lot of our graduates become general practitioners. Incredibly important role, obviously, in society. And I'm sure you all out there, if you don't go and see your GP that often, I'm sure your grandparents do or your little baby brothers do. And you know how important the GP is to everyone's lives. But then there are the other specialists. There are the specialists who do surgery, the surgeons, and then the specialists who look after kids, and I'm one of those. That's the work I do in the hospital. I work here at the university teaching students, but I also work in the hospital. I work at Sydney Children's Hospital as a paediatrician. There's the doctors who deliver babies, the obstetricians, the doctors who look after our mental health, the psychiatrists. They're the doctors that are working behind the scenes, analysing specimens, and like the pathologists, like the radiologists who are looking at MRI scans and x-rays. There's the doctors that are critically important for when you're having those operations, the anaesthetists. And this is just a tiny list of names. There's, I've left out most of the ologists, the dermatologists, I've put the gynecologists in, the dermatologists, the ophthalmologists, all the other ologists that there can be. And then you get into surgery, you've got a surgeon for every part of your body. There'll be a hand surgeon, an ear, nose and throat surgeon, a foot surgeon, a heart surgeon, a neurosurgeon. So many opportunities in medicine. And that's in clinical medicine. But you don't have to go out and do one of those things. With the degree that you'll get at UNSW, you can then set off on a new pathway doing something that's not necessarily just working with individual patients, but maybe with population health, public health physicians. Until last year, probably most people never heard of them. Who are the public health physicians? But now, in the last 12 months, we've been seeing public health physicians on our news screens every night, because they're the people that are keeping us safe, that are working on policy about COVID. The Chief Health Officer of New South Wales, Dr. Kerry Chant, just this week got the New South Wales Premier's Award. Dr. Chant's an alumna of UNSW, a doctor who's then also gone on and studied public health. There are doctors who run hospitals. There are doctors who do research as a full-time career rather than just doing clinical studies. There are doctors who, like me, do a lot of education. Some of them who do just about all education and don't see as many patients. And if you come to UNSW and study with us, all of these doctors will be there, be teaching you, will be helping you along the way, will be supervisors, will be mentors, will be tutors and lecturers. You might wonder, well, why does it take 6 years at UNSW, but some of the other unis, the medical degree doesn't take as long? And the difference for us is mainly that we're an undergraduate degree. Of course, you can get in there if you're in year 12 now, you could potentially be here next year. So you can come straight from school and start your medical studies at UNSW. And those 6 years take you along this journey to get you ready for graduation. The postgraduate degrees, you obviously have to do another degree first before getting into those. Our degree, our UNSW medical program, is structured around something we call the graduate capabilities. So the way we look at it is, by the end of this 6 years, what do we want you to look like? We want you to have knowledge about medical problems, knowledge about basic sciences, be able to talk to and examine patients. But we also want you to be ethical. We want you to be professional. We want you to be able to work in teams. And all these things together, we train you, we help you along the way, so that when you graduate, you are this really well-rounded doctor who can make a difference to other people's lives and to the world. The clinical teaching that you get, one of the great things about UNSW is we've got these great hospitals where the teaching occurs. Those first couple of years, it's mostly here at Kensington campus. As I said, sometimes in hospitals. But as you go through the program, you spend more and more time in hospitals. From where I am here at Kensington, if I go up a few floors, I could sort of just look out towards Coogee Beach, which is, of course, one of the great things about UNSW is the site here at UNSW at Kensington. Great place to be, close to the city. Light rail's just next door, close to all the beaches. Heaps of restaurants. But if we just look up the road to the east, we've got Prince of Wales Hospital, We've got Sydney Children's Hospital. We've got the Royal Hospital for Women, all UNSW teaching sites. If I just look over that way, I can see St Vincent's Hospital, the famous St Vincent's Hospital, Sydney. If I just peer over my shoulder and just have to look down towards the airport, we've got St George Hospital, Sutherland Hospital, and then look a little bit over that way, we've got the Southwest Sydney campus, which includes Liverpool Hospital, Bankstown Hospital, Fairfield Hospitals, Campbelltown Hospital. So all these are great teaching sites where you will spend some of your time. Now, you don't have to spend all 6 years at one of those hospitals. You do get the opportunities to move around. And again, another great strength of UNSW, we have our rural schools. So we have hospital clinical schools all around New South Wales. On the north coast, Coffs Harbour, Port Macquarie. Further south, we have Albury, Wodonga. And then just coming a bit closer to Sydney, we've got Griffith and Wagga Wagga. Students, and Jade, who's going to be talking to you soon, will talk about some of our entry pathways. Students who come through the rural entry pathway will spend a lot of their time in these rural schools. But even students who have come from Sydney, not coming through the rural pathway, can spend time in the rural sites, where it's a completely different sort of medicine. Well, same sort of medicine, but a different setting for medicine, and you see and learn different things in those rural sites. And it's really exciting. This year, we've just taken in first-year students into Wagga Wagga. For the last handful of years, we've had first-year students in Port Macquarie as well. So you could come through Wagga Wagga or Port Macquarie and basically do most, if not all, of your 6 years at either one of those sites, which is really exciting. So that's my summary, my overview of what our program's like. And I'm going to hand over now to Jade, who's one of our students. And I'll hand back to Nick, I think, to do the introductions. Thanks.
Thank you, Dr. Kennedy. And yes, I think some very sage advice. Many of us could probably be seeing our GPs more often, I feel. But hopefully that's giving you a really good insight into the depth of the program and some of the nuances of those different phases. We'll now dive into, by bringing up Jade here, one of the probably the most asked for sections so far, looking at the questions, is all the intricacies of the admissions process here, what kind of ASI you should be looking for, the UCAT ANZ, and also all the pathways that come out of that as well. So without any further ado, I'd like to welcome Jade Tran, who's a fourth-year student here and our Vice President Internal at the Medical Student Society. Jade.
Okay. Hi, everyone. My name is Jade, and I'm a fourth-year medicine student, as Nick said. So welcome to all of you today, whether you're a Year 12 student, you're a student currently studying at university, or a mature age student. Thank you for tuning in tonight. So I remember watching this exact presentation 4 years ago, so in 2017. And this was while I was in class in Year 12, clearly not paying attention to anything else. But I remember being super duper stressed over and overwhelmed by all of the different things you need to apply to, all of the different barriers to getting in. But I really hope today that this presentation, I'll walk through the admissions process with you and hopefully clear some things up about how to get into UNSW Medicine. So as Nick mentioned before, the UNSW Medicine program has been the most in-demand undergraduate degree in New South Wales for the past 4 years. So if anything, that speaks to how amazing the education is here. And if I can say anything over the past 4 years, it truly is an amazing program. The teachers, the staff, the people that you will meet are undoubtedly things that you will treasure for the rest of your life. So we have just under 200 places for domestic students. So even though this is quite competitive, there's no reason to think that you guys wouldn't be one of those students next year. So we just encourage you to give it your best shot. So I'll just talk a little bit about the application process. So with the application process, there's 2 different types of applications, and then there's 3 selection criteria, which we'll expand upon later on in this presentation. So the first thing you need to do, you just need to sit the UCAT ANZ. So we just register for that by 17th of May, and you sit that in July. The first step to the actual application, though, is applying to the University of New South Wales directly. So this is through our MAP, so the Medicine Application Portal. So what this is, it's just the website, as you can see on the slide. It's not assessed, it's just for us to process your application. So what that involves, we'll go and look and see what your preferences are for campuses. So the campuses have 3 different options at UNSW. So we have the Kensington campus, which I'm speaking from now. We have our Port Macquarie campus and the new Wagga Wagga campus. And all of these 3 places are amazing for teaching, and really recommend you guys to consider these 3 options when applying for UNSW. So that also just involves some little bit of questions, trying to get to know you a little bit and prompting you guys to think about what the interview process might be like. And so then after that, you'll apply to UAC. So that's the University's Admission Centre. That's just the one if you're in Year 12 or applying through UAC. It's the 5 preferences. So you would preference one of your preferences would be our medicine program. So the Bachelor of Medical Sciences and the Doctor of Medicine, and you'll have that amongst your other 4 preferences. But we just needed to highlight that it needs to be your highest eligible preference by January round 1 offers in 2022. And then after that, we just await your invite. So I talked a little bit about before that there's 3 selection criteria. So in order to get an interview, you're judged based on your selection rank, which is either your ATAR or an equivalent like IB, and your UCAT ANZ score, and these are combined in order to offer you an interview. And so something that we'll talk about over the rest of this presentation, these components aren't averaged, but they're combined together in an algorithm that UNSW creates. And in order to be successful for an interview and eventually your place, you need to score highly in every component. So scoring high for one component, such as ATAR, will not necessarily compensate for like a poorer UCAT score. Okay, so this is the part a lot of people have been waiting for. So the selection rank is also known as ATAR, or it's any other equivalent like IB. So the selection rank is your ATAR plus any eligible adjustment factors, which for medicine specifically is through the Educational Access Scheme. So of the applicants who were offered in 2021, the local median selection rank, or ATAR, was 99.82, with the lowest selection rank being 99.5. So before you guys get all stressed, I did really want to emphasize that though this is a competitive score, not to lose hope over this. Just try your best, aim for as high as you can, and just see what happens this year. And then just some other scores. For the rural entry, the median selection rank was 97.57, with the lowest selection rank being 91.35. So just some other things you need to know. We have assumed knowledge of English Standard to be Band 4 or higher, and this is required on behalf of the university. This is just so we know that you're able to communicate and research effectively as a doctor. And something important, we don't have any prerequisite subjects for HSC, so don't panic if you're in Year 12 and you don't do chemistry or biology or anything. Just chemistry is something that we strongly recommend you doing if you haven't chosen your subjects yet. And lastly, if you're eligible for the Educational Access Scheme, this is things like illness during your HSC, your ATAR will be adjusted accordingly. But unfortunately for medicine, there's no other types of adjustment factors like it may be for other degrees at UNSW. And unlike a few years ago, the predicted ATAR won't be considered. The interview is offered based on your real ATAR that you'll get in December. All right, so the UCAT ANZ is another component of getting into medicine. So just in case you guys aren't familiar with the UCAT, so it's no medical questions, it's a computer-based test. It's got 5 different sections that are individually timed. UNSW doesn't currently include the situational judgment mark, but this could be subject to change. It's done early in August and July, and it's continued in different sessions throughout the month. And so results are given to you immediately after the exam. And last year, the applicants who received an offer, the local median score was 3,106, with the lowest score being 2,890. And the rural score accordingly is also on the slide for you. So what we do recommend here at UNSW is that don't do third-party preparation courses. Just because the UCAT as an exam is quite volatile, we can't guarantee that that will actually aid your performance. In fact, it could detriment it. Free practice questions are available online at the UCAT website, which is listed on the slide here. And it's quite helpful in your preparation to get familiar with, what's going to happen in your actual UCAT test. So we also wanted to note that the lowest percentile that's considered for interview eligibility is 50%. So this means you need to score a minimum of a 50th percentile. But obviously, due to the competitive nature of the medicine program, the actual percentile could be a little bit higher than this. Okay, so the last criteria for the application to get into medicine is the interview. So all this interview is just trying to get to know about you as a person. It's a structured interview over a certain period of time, and it's got 2 interviewers, so someone from our medicine faculty and then someone from the medicine community or the community, just a general community member. So just thinking back to my interview, it was a very, it's not something to be expected. It's just a conversation, really. It was much less formal than I thought. Very chill. They were very nice. All you need to do is talk about, your passions of why you want to do medicine. And I think just come prepared, just thinking, why do I want to do this? Why am I interested? And you'll be okay. So for this, for the 2021 intake, we had 3,362 applications for the interview, but we held 472 interviews. And then the rural is also listed on the slide for you. And so we don't recommend interview coaching again, like we don't recommend UCAT coaching, because it's easily detected. Our interviewers are very knowledgeable, and so, you can kind of see that dishonesty or that crafted nature of questions. So, there's no trick questions that we ask in the interview, so just be honest if you want to do your best. And I know people say that, but it's very true. Just be honest. Okay, so just some dates that you might need to know. The interviews for rural applicants and then your domestic applicants and then interstate will all kind of vary depending on when you apply. So your interviews for the rural applicants will be in November this year. Your New South Wales will be December 2021, and then for interstate or overseas applicants, it will be January 2022. This is just another slide with an overview of the timeline. So again, just sending your UCAT ANZ in July. You have to apply to both the MAP and your UAC, with the applications due 30th of September for the MAP, and then your interviews, which are held in those months. And this is just a really big timeline of everything that you need to know. I've kind of talked about some of these already, but I just wanted to point out a few that might be of interest to you, especially if you're in Year 12 at the moment. So we have our UNSW Open Day, which will be the 30th of September 2021. This will still be just before your HSC, so you'll have time to go and have a look at that. Your ATARs are released around, November, December, and then you've got your interviews there. If you do want to refer to any of these dates though, we recommend you going onto the website. There's a link below and, just getting yourself familiar with those dates just so you don't miss it. Okay, so we're just going to talk a little bit about campus selection and bonded places. So like I said before, we have 3 different campuses. We have our Kensington campus, our Port Macquarie campus, and our Wagga Wagga campus. So you will specify that in your MAP application. However, If you do preference more than just one, so usually people try to, tend to favour the Kensington campus. If you put your name down for the other campuses, you obviously have a bigger opportunity to get a place because there are more places for you available. In saying that though, don't just put them down if you genuinely are not interested in going. Even so, it's a really nice experience to go to our rural schools. Like Sean said before, you have a really different experience to exposure in rural medicine that you won't get in the city. You'll have a lot more hands-on kind of nature. You'll get to know your doctors a lot more. So I really recommend that you guys think about that in factoring your decision. Okay, and for bonded places, so we used to talk a little bit about applying for a bonded place and then an unbonded place, but now everyone is automatically considered for both, and it's just judged on a competitive basis. So if there's X amount of bonded places or unbonded places, we'll give them to the top X amount of applicants, and then those who come after will be offered a bonded place. Okay, so just with bonded places, that's just 1 year requirement, I believe, going to a rural or a location of need. But to just verify that, I would strongly recommend going on to the Commonwealth Gov website, which talks a bit more about the bonded places program. There are some special admission schemes that we have at UNSW for students who may be entering, due to different pathways. So our first one is the lateral entry scheme. So this is for UNSW Medical Science students. So what you do is you enter the UNSW Medical Science degree. In your second year, you will apply based on your core medical science grades rather than your WAM or your ATAR score. And then you will sit the UCAT ANZ just as every other applicant or school leaver will be doing. And then up to 10 applicants after an interview will be selected from that group. So due to the amount of places, like 10, it's very, very competitive. So we would recommend that don't choose medical science just to attempt to go down this pathway. Choose medical science if you genuinely love it. It's all about research. It's honestly a really important part of still being integrated in the medicine, life. Don't choose it unless you're passionate about it. And then we have our Indigenous entry schemes. So what this is the Aboriginal or Torres Strait Islander students can apply for a 3-week pre-medical program through Nuragili, and successful applicants will continue on to the medical program. Another entry scheme we have is the Rural Entry Scheme. So it's for applicants who live in a defined rural area. And a new scheme that we've introduced last year, and will be running again this year, is called the Gateway Entry Scheme. So it's something that we're super excited about. So what it is, it's for low socioeconomic applicants who are in gateway identified schools, which you can go have a look on our website, what that's defined as. And this is from metropolitan areas. So up to 10 places are available through this pathway every year. So, there's no harm in going to look and see if your school is on there. And you just, do the same thing as normal. You submit your UEC application and go through the interview process. Lastly, I just wanted to end off with talking about alternative pathways. We've been talking about the admissions, the pathways to admissions, the UCAT scores or the ATARs that require to get in. And I know that can be super duper stressful. But we do want to kind of encourage you guys that there are so many different pathways into medicine. And if you're truly, truly passionate about being a doctor, you can get in no matter how long it will take, because that passion will, be evident and it will shine through. So the first way you can reapply, you can sit the UCAT ANZ next year and you'll just do the process again. You can get a head start with another degree. So you can start a medical science degree, like the lateral entry pathway that I talked about before, or some other unrelated degree. Your results of 1 year full-time study will be considered along with your selection rank. So there's some minimum requirements, like obviously sitting the UCAT ANZ as well. There's also the lateral entry scheme, which I talked about. You can apply for postgraduate medical schools at other universities, or you can try out another clinical or medical career. So that's like medical science, physiotherapy, exercise, physio, OT. There's so many different roles. Medicine is all about working in multidisciplinary teams. So I really encourage you, even if you have that passion for medicine and you're not able to get in, there are so many different other career choices that, you know, fall into that category. Anyway, I just wanted to wrap off saying thank you guys for listening. We really do encourage you to try out for, you know, medicine. You know, it's a great program, and UNSW is like great. So thank you.
Thank you very much, Jade. UNSW is indeed very great. I can attest to that myself. I can see we've got lots of questions coming in. And look, I mean, there's also a lot of content that we've just covered off in a very short space of time. So don't panic. This recording will be available for you to catch up on at your leisure. We'll be sending this out in a link over the coming days. So if you missed anything, if you missed some of those slides that have the median ATARs and the median selection ranks and that, don't panic. You'll get the chance to catch up on that at your leisure over the coming days. So moving from the admission side of things now to the student experience and really giving us a bit of a behind the scenes look at what it's like to be a student here at UNSW is the president of our Medicine Society. And so I'm going to actually introduce Michael Orjak to come up here and run us through a bit of the in the classroom experience, but also all the exciting stuff that you can get up to outside of the classroom here at UNSW. Michael, over to you.
Hello, have I got the thumbs up? Perfect. Thank you, Nick, for introducing me. And yes, I'm Michael. I'm a fourth-year medical student here at UNSW. And this year, I have the honor of being the president of our UNSW Medical Society. And also, I get to talk about the UNSW student experience because I have way too much to talk about because it's very enjoyable. It's a lovely program. So as Sean Kennedy was saying before, when you enter the program, it's split into 3 phases, each of 2 years. So when you go in, you hopefully get accepted, you're passed through all the nitty-gritty, and you've done all the celebrations about getting in, and you're all very excited. From day 1, you'll be put into phase 1. So within that, you're put into 4 different colleges. And those are colleges that are named based on amazing medical heroes, such as Fred Hollows, David Cooper, Elizabeth Blackburn, and Fiona Stanley. So you get placed into these colleges with your colleagues from medicine, and you'll be going and doing everything with them. You'll be going to lectures, you'll be going to practical classes in the anatomy labs, looking at cadavers and learning super hands-on, as well as going into scenario groups and learning case-based learning, which is very exciting and an amazing opportunity that we have here in UNSW Medicine. And so within these colleges, you'll meet friends, you'll meet colleagues that you'll see many years down the track, and you'll make friendships that will last for decades. And one of my personal favorite experiences is meeting these friends, and I'll talk about MedCamp in a second, which is one of the amazing events that we get to run at UNSW. So I'll go through that in a moment. So you get put into your colleges from day 1. You go to your classes together. You start meeting new people, and it's all very exciting. And so then when you go to your classes and you're learning case-based, it's incredible because you get to learn about people who are real patients, and it's integrated into all of our learning. It's like put around the spheres of patient-centered care, and then with that, it leads very seamlessly. Then when you get put into hospitals, after your first 2 months, you get put into hospitals, you get the opportunity to go there every fortnight. And then practice based off of these case-based scenarios. You then get to go into the hospitals, apply your knowledge, and actually see patients from like 8 weeks into the course, which is an absolute honor, and it's an incredible opportunity. And this is all just within the sphere of what we do, like for academic learning, not to mention also the things we do outside within our colleges, which sports and all the different events you can attend. So this is where I get to hopefully get everyone a bit excited about joining UNSW and hopefully UNSW Medicine as well. Because we run so many events here. We're a medical society that are 1,600 students strong, and our volunteers are incredible, and there are so many of them. We have over 200 to 300 volunteers across all the 1,600 students, which for a student society is crazy and is like running a small company based off of volunteers. So it's very odd, but it's also amazing the opportunities that we get to create. And so one of those that I was talking about previously was MedCamp. So in your first few weeks, COVID permitting, you'll get to go to this amazing event called MedCamp. It's a weekend event. You go away, you get your tickets, you go into your buses, and then you go to this camp. Limited technology, a lot of fun. And you get to meet each of the people within your college as well, but also the people in the different colleges within like your medicine degree. And because it's a fairly small cohort, you get to meet almost everyone in the degree. And these will be your colleagues in medicine down the track, but you'll see them doing all manner of things at MedCamp. And there are some exciting photos on there as well already. And also another thing that I forgot to mention there is that we have an amazing peer mentoring program that everyone signs up to. We get put into groups with your scenario groups that are based around that case-based learning, and you get paired up with older year students. So one of the things you'll very much learn quickly is that medicine is a community. It is incredibly ingrained in the nature of medicine to teach and be taught by the students around you. And the learning community and the support available is just something that I've never seen before and never been a part of to this extent. You genuinely join into this community and you feel a sense of place and you feel like you've joined another family, which is just incredible. And so one of the ways we do that is everyone gets put in peer mentoring groups, and then following on after you do your initial peer mentoring, you get the opportunity to be matched on one-on-one with older mentees as well. And so that's just for phase one, and I haven't even mentioned everything. I'll try to blitz through some of the other things to get to exciting opportunities that we have as well. But the first 2 years, phase one, you get to integrate with year two students as well, which is something that is very unique to the medicine degree. But in the first semester, so the first half of the year, you'll be with your own year group, forming connections there. And then in the second half, you'll pair up first years and second years together, and it's an amazing opportunity to first of all learn from your older years students who have just experienced what you've been through, and for also when you're in second year to give back and also get the opportunity to learn how to teach, which is very central to medicine. So then once we move on from phase one, we go into phase two. And it's when you start to become more independent, as Professor Kennedy was talking about, or Sean, as we like to refer him. You get placed in the hospitals, you're in there 3 days a week, and you just get so much clinical exposure. It's such an opportunity, and you'll hear it time and time and again. It's a privilege, and it's such an amazing thing that we get to do. We get placed in there. You might go for a rural placement as well, and we've gone through some of our rural campuses of Wagga Wagga and Port Macquarie, but we've also got other rural campuses as well, all across New South Wales, such as Albury, Wodonga, and also there's more. I shouldn't go through them because there's a lot, and there's a lot of opportunities there. And Jade and Sean was saying, the type of learning you get there is very hands-on. You get to form even closer relationships within the smaller cohorts that are there. Then you'll go into your fourth year, which is your research year. You'll have the opportunity to do an honors project, and we have an amazing convener for our fourth year who's providing more and more opportunities for research as it's becoming more and more central to the field. So you'll have more opportunities to do course-based assessment as well, and coursework and exciting opportunities that you get to learn firsthand from like professionals doing postgraduate courses. It's very cool. And then after that, you'll move on to phase three. An amazing part of phase three, as one of the picture shows there, is that you get to go on electives. And by the time that you're in phase three, hopefully You can go international, no problem, and there are often groups of people who go overseas, and it's an amazing formative experience, and you get to practice medicine in so many different ways that you just don't get to within the normal teaching. So these electives are an amazing part of becoming a doctor, and they really start to speed things up in your learning, and it's very exciting once you get there, I've heard. I'm going to be there next year, so I'll tell you once you're in the program next year. And then we're going to talk about a bit about ARC as well. So ARC is our student life at UNSW. So we, as a medical society, fall within ARC, as it's the student life for all of UNSW. So as you can see here, there are so many opportunities that ARC provides outside of the medicine sphere as well. If you have an interest in photography, archery, anything you want to do, tea, I'm part of a tea society, there is it at ARC and at UNSW. There's go to O Week, sign up to everything you can, and get on the executive teams, because it's something that I had never done leading into medicine. I hadn't done many leadership things, but being part of the executive team and having the honor to be president this year, I'm learning so much. So many skills for managing teams and also creating this atmosphere of excitement and enjoyment. And you will get to do that as well, because there are so many societies that you'll be able to be a part of whatever you want. And all of these opportunities is really the central thing that I think we want to get across, at least I want to get across. There's so much going on, and it's so dynamic. Even if you don't go into medicine and you still choose to go with UNSW, there are still so many amazing things that we can do. And then I've only now made it to UNSW Med Soc, and I think I'm getting the little wrap-up symbol. But very briefly, UNSW Med Soc, we are this massive organization of student volunteers who aim to to promote advocacy. So we sit on all the meetings with Professor Kennedy, with all of the academics, and we advocate for our students. We create these amazing experiences and events that you get to go to. And first and foremost, from that, we create a community in which you become part of a family and you want to give back to that family. And it's incredible. Within that, we have so many things to make it more inclusive, more diverse, and there's just so many different things. We have our women's in medicine officers, we have our career officers, we have our EDI officers, and Jade, our Vice President Internal, is in charge of all of those and in charge of making sure those advocacy efforts actually get to the faculty and end up in curriculum changes, which is just incredible that you can have so much impact as a student. Then we also have special interest groups within that. So if you're interested in a specialty like critical care or surgery, we also have that. Performing arts groups. This theater is used for medical musical society performances, and I performed right over there as part of it on the piano. And that's one of our 2 performing arts groups. There's also Med Show. And if you get in, you'll hear a lot about Med Show, because it's this amazing production which is handwritten by students, and we get to direct it, and it's over 100 volunteers on this stage production. The funding is thousands of dollars. It's incredible. Even if you don't make it in, you should still come see it, because it's incredible. So I think that's my last slide, and I think we're about to move on to the Q&A. But apply for medicine, do all you can, and I hope to see you next year, and where you can become part of this community. Okay, and now I'll pass back over to Nick. Thank you.
Thank you very much, Michael. And yes, unfortunately, we did have to give you the little wrap-up emoji in real time here, just because there's so many questions that have been coming through. So I'm going to get Michael to run around and jump into the panel. And we're going to dive into as many of these questions as we possibly can. There's lots of those nitty-gritty admissions questions, many of which we've actually covered already throughout the section Jade was talking about. So again, remember, you can see this as a recording in a few days' time, and you'll be able to go back and double check all that information. We'll also be sending out a whole bunch of useful resources and links to the website where all of this information is laid out. Things like our medicine timeline, all the key dates that you should be throwing into your calendar, whether you have a phone calendar up on the wall, somewhere visible so you don't forget to register for the UCAT, so you don't forget to apply via the medicine application portal and through UAC, all that kind of stuff to make sure that you are well supported throughout the year and ready to give it your best shot to apply for medicine. So I'm going to jump into the panel as well now, and then we'll kick things off, and we will keep you for about another 10 or 15 minutes. If you need to jump off, totally fine. You can catch up with us later on in the recording, but let's throw it to the panel. So I think we're live, which is great. This is the great thing about doing it as a live stream with all of you jumping in at home. We do love doing it in front of an audience, but this is the best we can possibly do under the circumstances. I'm going to throw the first question over to Dr. Kennedy, or to Sean. What sets the UNSW Medicine program apart? Lots of people have been voting on this question. What, to you, do you think is the defining feature, if it can be boiled down to one?
I could talk a lot about it, but I think I'll just show you something, and that's the two people sitting next to me. These two guys, Jade and Michael, are great examples of what sets UNSW program apart. It's the students, and it's the quality of our students. And that partly because of the selection, as Jade went through. It's not easy to get into UNSW Medicine. We don't just let anyone in. We actually are quite selective about who comes in, and so we've got these three ways that we select. But also, once you're in here, it's just a great course. You get to work with other students, you get to learn in teams, you get to be fantastic communicators, like you've seen from Jade and Michael today. They're enthusiastic, they enjoy the course. And these guys are only in fourth year. They've still got 2 more years to go. So imagine how good they're going to be in 2 more years. And that's really what sets the course apart. I think it's the students that come in are really good, and by the time they get out, they're even better.
Excellent. So I might throw the next question over to Michael, putting you a bit on the spot here. We did speak before about the assumed knowledge and the recommended studies. To clarify as well, because there's been a few questions about the English standard, it's not a requirement from UNSW. Assumed knowledge is only, it's recommended. It's something we advise you to have because it's really going to set you up to succeed in that, the course that you're going into. So we recommend English standard with a band 4 or above. If you haven't met this, you will probably just find that the course is more challenging. And again, it will never prevent you from getting into the course. There's no prerequisites at UNSW for our undergraduate programs, but we really recommend it. And so the other thing we recommend, though, is chemistry. So Michael, how much chemistry, particularly in your first couple of years, have you come across? And do you feel like there is that gap there if you haven't done chemistry, given we recommend it?
No, of course. It's an interesting question as well, because I think that it often comes up when you're talking to students, especially in those first 2 years, because it does come up. And having that sort of basis in chemical knowledge and just understanding how reactions generally work, I think that is something that having a bit of a basis and having done that in high school, because I myself did do it, so I found that very useful because you sort of understand those base concepts already, and you can then use that as a foundation to build upon. But I also have many friends as well who didn't do any sciences, got them purely on the merit of being incredible people and very intelligent, of course. But they also just, took the time, they learnt it from the ground up, and then, part of the learning community that we talk about here is you get to talk with your peers, you get to talk with your older years, and if you aren't too sure about anything, you can always just ask another peer, and they did that, and it's also just because it's so supportive, you can also learn all of those skills here within medicine. So I think that...
Yeah, brilliant. Yeah. And I think that's true. It's the resilience as well. If you are getting into the program, you've clearly got that drive, and that's really something that we'll encourage and will nurture at UNSW, but also from the academic side is going to set you up in really good stead. Jade, before I get to you, actually, I will put you on the spot, but okay. Before I get to you, we were talking before about the bonded medical scheme, and It has actually changed since you commenced. So I know you mentioned 1 year return of service for the bonded medical scheme. It has changed recently, so it changed again, I think, last year, and it looks as though it's shifted back to 3 years. So as we recommended, jump onto the Commonwealth Government's website to double check what it's likely going to be for you. Again, the terms have become much more flexible in terms of how you negotiate and arrange that return of service, but it is a contract ultimately that you make with the government. So best for you to jump onto the website there and have a look at how that might affect you if you get a bonded medical place next year. To put you on the spot though, by far one of the most common questions that's coming through is about alternative pathways. How can I get into med if I don't get in this year? Do you want to give us a quick recap on that slide we were talking about before about what alternative pathways are available to students?
Yeah, of course. So just to emphasize this before I talk about it, there are so many students in our program that have come through different entryways. You don't necessarily have everyone, starting in first year straight out of year 12. You have people who defer. So I saw that was the question. You can do that. People who come through the lateral entry scheme, people who come a few years after they've done a bachelor's degree, but they haven't graduated from their bachelor's degree yet. So just a few ways. You can apply for the UCAT ANZ again the year after. And you just do the pathway again. You can start a first year of a different degree. So that could be science, arts. You just do the same thing. You'll be based off your WAM instead of your ATAR, of course, but you'll do UCAT, you'll do your interview as normal, and then you'll be, judged on the same kind of playing field as everyone else. You can also do the lateral entry scheme, which is going through the Bachelor of Medical Science. So that's, again, to recap, that's where you enter as a Bachelor of Medical Science student. In your second year, you can apply to transfer to the medicine program, and then your application is based rather on your WAM, it's based on your core medical science units and how well you perform in UCAT ANZ and your interview. So again, that's only 10 places available through that way, but you can consider it for sure as an alternative pathway if you don't get in through that way, still wish to do medical science or want to maybe expand some of your options there.
Brilliant. And look, while I've got you, I'm going to, again, throw you on the bus here with this question. Keeping on the theme of admission requirements and entry, if I'm an interstate applicant, is there anything that's different? How do I apply?
So interstate, apart from maybe, there's no differences in ATAR, I think.
No,
I think pretty much it's the same. You just apply through.
I've definitely thrown you under the bus, sorry.
Yeah.
But yes, it is very much the same. I think probably the only thing to touch on really is the fact that the timeline for interviews can be slightly different. And I think we did cover that in one of the slides you were talking about with the timeline, is that we tend to do interviews in two kind of rounds for local students, so for domestic students. So we'll do New South Wales and ACT applicants in the first round, typically held straight after your ATAR comes out. So that's just in that period between, as soon as it comes out and locking in your preferences, that kind of 20-ish, well, actually the timeline's going to change this year, but it's middle of December. And then we also will have interstate applicants interviewed typically in mid-January. And the reason for that is because we know that medicine's really competitive and you're typically applying for a lot of different medical schools. And indeed, we encourage you to be applying to as many medical schools as you're interested in. And we know that a lot of students who are interstate will, if they get into an institution in their home state, they probably are going to choose that over moving further afield. So that's the difference there. But we know as well how many students are going to come from interstate typically every year, and we make sure we're reserving enough spaces for them. So there's no disadvantage there. It's just a slightly different timeline, but exactly the same process as you were saying.
I just have one thing to note. So depending on your home state, you'll have a different application portal for universities. So like Victoria has like VTAC, I think Queensland has QTAC. You would just apply for UAC as well as your home state.
Yeah, definitely.
So just keep that in mind.
And so I'm going to go back over to Sean. I know Jade was talking before about the interview process and the kinds of, the kind of structure that we use and how she found it very informal. What are we looking for in students in that interview? I imagine you've sat on quite a lot of panels over the last couple of years.
As Jade said, what we're not looking for is someone who's rehearsed and schooled and just comes in and sort of says pre-rehearsed answers. That's not what we're looking for. We're looking for someone who we think will be a good medical student And someone who we think will be a good medical student is someone who we think will be a good doctor. And so that's someone who's honest, someone who understands a bit about themselves, someone who can demonstrate, why you want to do medicine, why you want to study at UNSW. And you can demonstrate that by talking about how you feel, how you think, but also by giving examples of things that you've done before. If I go back and we think about some of the stuff we've talked about that we're looking for our graduates, about teamwork, about communication, if you can show that you've been a team player already through school, through extracurricular activities, that's going to help. But as Jade said, what we really want is for you to be honest and open, and hopefully for most people doing the interviews, the experience will be similar to Jade's. It's fairly informal, it's not too scary, and it's getting to know you as a person.
Brilliant. And Michael, I'm going to throw the next question to you. It's a little bit of an admissions-y question, which you're probably not familiar with, but I'll cover the admission side of things. So there's a few people asking about gap years. Can I take a gap year if I get an offer into medicine? Yes, you can. So if you're a local student or an international student, you can take a gap year. It has to be approved ultimately by the faculty, but it is possible for students to defer. And I know in the current climate, that might be something that students are considering. But from your perspective, if you take a gap year, I think people here have asked, is it not advisable? Do you know any friends or colleagues who have taken the gap year? What was the difference for them? Did they find it was just as easy, or was it more challenging?
Definitely. And it's one that I think I saw the question beforehand, and I thought like, oh no, I have tons of friends who have done it. Right. Yeah, no, so I think that from what I've heard, and I'm sure Sean could confirm this hopefully, but if you do take a gap year, it definitely does not negatively impede your ability to do medicine, like your study skills. Like I think it focused on study skills, they certainly aren't decreased, because having the courage even to take a gap year and to have the confidence that you want to take a year to develop your own skills and yourself often takes a lot more courage and initiative than just going down the pathway. So in fact, from what I've heard as well, and from what I've seen as well, is that people who do take a gap year can often come out of the other side a lot more learned, a lot more comfortable with themselves, and will ultimately, and are ultimately a lot happier that they took a gap year, and ultimately I think will come out as better doctors, because they wanted to take a gap year, they took it, and it can be very empowering that you managed to do that, and it's definitely not looked down upon for an admissions side of things as well.
And Sean, I can see you nodding along on the side there. Is that something that you've equally seen in terms of the students that have been coming through the cohorts?
Yeah, I was just thinking, I think we've made UNSW Medicine sound fun and sound great. I hope Michael's talked about all the fun you can have, but we can't sugarcoat it too much. It is hard work. It's you have to work hard once you're in and once you study, and there are times where you'll be stressed. There will be times where you'll be up late studying. There'll be exams that you might not go as well in as you thought you should have. So it's not always a bed of roses. So I think you've got to be ready, and as Michael said, you've got to know yourself and be confident in yourself. So if that means doing it in your own time frame as opposed to what your colleagues are, then if that's what suits you, that's the best thing for you.
Yeah, fair enough. I'm going to throw the next one to Jade, and we're getting through most of the questions. So if you do have any final questions, throw them our way, and we'll try to get to them. Next question I'm going to throw to you is about medical science. So some students have said, is it bad to go down the route of doing medical science if I don't get into medicine? I think we kind of spoke about it a little bit before, but overall, what's your kind of perspective on that?
On medical science in general? Yeah. So medical science is kind of similar to medicine, except that the clinical aspect is, different. A lot of it is to do with like research. You're the people who, research the science behind things that eventually doctors can use. I have a few friends who are in medical science who do it not for the medicine pathway, they just purely like medical science. They still learn things like anatomy, physiology, pathology, UNSW offers courses like that to people, even if you're not in medicine. So like if you're still really passionate about doing those kinds of topics, for sure, like medical science is a great, pathway and career to go down.
Sean, I'll throw to you.
Yeah, so I agree with what Jade said. So, you might not want to be a doctor, but you want to learn something about medicine and health, then medical science is the way to go. But if you think that it's a pathway into medicine, at UNSW, it's a great course, Bachelor of Medical Science. Only a small number of those students will get through, though, into that lateral entry pathway. But if you've done it at UNSW, then you could apply for other universities, their postgraduate medical programs. So it sort of opens those opportunities up as well.
Yeah, definitely. So fantastic program, obviously, but not a reason to go down that route if you're thinking, look, I'll get in via the lateral entry pathway, because it is a very competitive pathway. So do it because you love medical science, because you want to make an impact. And it's one of those other degrees we were talking about where you can have a really widespread impact on healthcare and the quality of lives for people in general. And so look, I can see we're kind of getting to the pointy end of the night where I'm now getting the wrap-up symbol from the people in the back, which is great. Question to everyone here, and this again, one of the other kind of really popular questions is, if you knew one thing, and maybe this is less relevant for Sean actually, but if you knew one thing, actually, well, no, I think it's still relevant. If you knew one thing before getting into medicine that would help you, what is that one thing? Maybe I can see Michael has a deer in the headlights kind of look about it.
I do too.
Okay, let's pass on to Sean then, and we'll work our way down the panel.
What the cogs think.
Can I have the question again?
If you knew one thing before getting into medicine,
Yeah.
what would that one thing be that would help you out?
I think go back to what I said a few questions ago about it can be stressful. I would say don't stress, and look to your friends, to your peers for support, and be open with your teachers and your tutors and your supervisors, because everyone's actually there. Once you're in, the goal of everyone is to get you through. It feels like you've got to struggle and pass exams and things like that, but in fact, we're not trying to stop you, we're not trying to hold you back, everyone's there to help you. And so if you're open and look for that help, it'll make it easier for you.
Excellent. I'm going to throw it to Michael now, who's looking more comfortable about the question now that he's had a moment.
Yes, no, a moment has passed, and I've got some ideas. But boiling it down to one thing is very difficult. I think the one thing that, really would have helped, I think I've answered a lot of this question once you've gotten into medicine, but before getting into medicine, I think that the biggest skill that will help you, like if you get into medicine or going into medicine or even just throughout life, I think is becoming like more honest with yourself. Like Professor Kennedy was saying, or Sean, I should just say Sean. But it's really that honesty with yourself and becoming more reflective and taking the time to actually sit down with your emotions and actually think like through what you're experiencing, because oftentimes in medicine and before like medicine, the entry pathway, it can be incredibly stressful, and there's always going to be so many different pressures and also so many different opportunities and so many things that are going on. And I think having the ability to be honest with yourself and take a moment and step back, I think allows you to take a bit more perspective. And I think that's one of the biggest things that I've learned now that I've been going through medicine, and it's something that I really wish that I had known beforehand, is just be honest with yourself and actually take that moment to be like, okay, this is very stressful. I need to call a friend. Because it can be very difficult, especially for a lot of the people who want to apply for medicine. We fall into a lot of people fall into the personality type that they don't want to reach out, you can do everything. But one of the biggest parts of medicine is understanding yourself, and part of that is being vulnerable. Mm-hmm. So being reflective and honest with oneself.
Yeah, and I can see Jade's been nodding along the entire time. I'm assuming similar kind of message
truly.
there.
Yeah, so I really agree with Michael. Something else I think is really important is to have perspective. So Like in year 12, I know we've been talking a lot about like, oh, it's so competitive, so like work really hard, which I agree. Like academically, medicine is a very rigorous course. But in year 12, I gave up like a few of my extracurriculars like singing and music, all of that, just to like, you know, focus on getting into medicine. But if anything I've learned in the actual medicine program is that I regret doing that, because to be a good doctor, you can't just, you know, be academically smart. Like you have to be well-rounded. You need to be confident in yourself. You need to have, you know, a lot of worldly experience, whether that be through, you know, like the people you meet in extracurricular activities, or, you know, just being compassionate, like in doing things like volunteering. You need to have all of these things to be a good doctor, because you can have all the knowledge in the world and, you know, tell your patient, but if you can't empathize or, you know, be human with them, then no one is going to really love you being their doctor. So in my opinion, like having perspective and not losing sight of the things that you like and things that make you, you know, inherently human, is something very important to keep like for the rest of your life, not just, you know, in high school in medicine.
Yeah, no, look, I think that's some really, really good advice. We took a bit of an interesting philosophic turn here. I hope everyone at home is enjoying this. But that does bring us to the end of the night. And again, I know there's plenty of questions that we haven't been able to get to, but we will be in touch to answer those questions and to send out a whole bunch of resources via email to make sure that you're well supported. I will say our future student advisors are here around the clock. Not necessarily 24/7, but they're here 9 to 5 weekdays. They're always happy to help. Their entire role is about supporting students to work out their unique pathway into UNSW. So if you've got any questions or concerns, things that we haven't covered, reach out to them. You can email, live chat to us. You can give us a call. We're always happy to have a chat and to help out. There's lots of other events as well that will be happening throughout the year. So this is really just kind of the first major kind of event that kicks things off for the year. But if you're in year 12, then there's things like the Degrees and Scholarships Info Evenings to get you thinking about the scholarship side of things, our open days, info days, which are really essential to get along to. But even if you're in younger years, I really recommend go along to an open day at the very minimum. It's a great way to get a feel for the uniqueness of a university. Every university is different. Every campus has a different vibe. So see if you can see yourself studying at that university, talk to the current students, talk to the lecturers and the academics, and really find out what makes them tick. And indeed, all the exciting stuff that you'll be able to get up to when you are in their shoes. Apart from that, I'd like to thank all of our speakers today. So Dr. Sean Kennedy, Michael, Jade, thanks for giving up your time and sharing your insights. And also thanks to everyone who joined from home. I know it's a bit of an unusual way for us to be connecting. It's kind of becoming the new norm, unfortunately, but we look forward to hopefully having many of you on campus, not too far down the track with things like our open days and info days. Otherwise, on behalf of the panel and myself, and indeed UNSW, we wish you all the very best for your studies and look forward to seeing you on campus sometime very soon. Cheers.
You're the person the world needs. You may not know how or why yet, but you know you're here to make a difference. Few people have great ideas. Even fewer make them happen. It takes a dreamer, a researcher, a leader, a thinker. It takes someone like you.